Good morning. Thank you everyone for coming. My name is Laura Antonini and I'm a staff attorney here at Consumer Watchdog. In order for Obamacare to succeed, consumers need coverage with affordable access to doctors and hospitals. But consumers face threats to their financial well-being and their health because of 5 pitfalls that we're going to discuss here today. Narrow networks, EPO plans, multiple deductibles, canceled plans, and insurance company profits. I'll go through each of these pitfalls and discuss them one by one and give some tips for consumers on how to protect themselves against these pitfalls. And I also have some consumers here with me who are going to tell their horror stories. Californians can purchase their health insurance coverage right now, either through the Covered California Exchange or directly through an insurance company. They have until January 31st, 2016 to enroll in new coverage. If they want coverage by January 1st, you have to enroll by the end of the day, December 17th, tomorrow. So this holiday season, health insurance companies are delivering 5 lumps of coal to consumers in the form of narrow networks, EPO plans, multiple deductibles, canceled plans, and big profits. So the first pitfall that consumers face are narrow networks. Narrow networks are when insurance companies dramatically reduce the number of doctors and hospitals that are covered in-network under plans. Consumers who can't find in-network doctors face a choice. They can either delay their care or pay for care out of pocket and face huge medical bills. On top of these narrow networks, a lot of the companies have posted inaccurate provider lists to their websites. So they'll say one doctor is in network when the doctor is actually out of network. Consumers rely on what the insurance company tells them. They rely on these provider lists. They're inaccurate. They end up with huge bills when they go to these doctors. One way to avoid getting hit with unexpected out-of-network bills is to keep good records, take screenshots of provider lists, and make sure you capture any representation that a specific doctor is in network. Unfortunately, the reality is that sometimes, even when you do confirm that your doctor is in network or covered, an insurance company may still refuse to cover your claim. Consumer Watchdog is currently litigating 4 class actions against health insurance companies for misrepresenting their providers and their provider networks. And with me here today is Barry Weiss, who's one of the lead plaintiffs in our lawsuit against Blue Shield for misrepresenting its provider networks. And Mr. Weiss will say a few words now.
Thank you. Thank you. A lot of what you just heard is not only true, it's been almost purposely manipulated, and there is no way that even with the protection that were suggested, you may not still find yourself in this trap. A couple of years ago, I shopped for a new health plan, and I did the first thing that any logical person would do, which is make sure that our longtime main provider and other key providers for our family's health and well-being were going to be covered under this plan. So I went to the Blue Shield website. All the providers were listed on the PPO plan. I called Blue Shield. They said, yes, they are all on the PPO plan. I even talked to the doctors who said, if you're Blue Shield PPO, don't worry. We're going to be on that plan under Covered California. So I signed up for the plan. Come January, I find out that most of my doctors were either dropped from the plan or did not accept the plan because the reimbursement rates that Blue Shield offered them had dramatically changed. And now we were stuck for a year because it was past open enrollment, and we had no choice but to pay much, much higher deductibles, co-pays, everything for that year because we were completely misled by every source that we could find at Blue Shield. And I called multiple people at Blue Shield to confirm this stuff, because with the new Obamacare plan rolling out, we wanted to make sure before we bought the plan. So the first time I found out about it was when we visited our doctor in January, and they said, "Oh, we're not going to take this. But I thought you said you were on the plan." And I said, "I know, but they didn't offer us a contract, or they dramatically reduced our reimbursements, so we didn't accept the contract." So I felt completely betrayed by Blue Shield. I called them and said, "What happened here?" And I got 3 or 4 different responses from different people at Blue Shield. They clearly did not know what they were doing, and clearly misled consumers by publishing lists that were verifiable, that showed doctors on their plan who ultimately were not on the plan, which hurt consumers tremendously at extremely higher costs for use of the plan.
Thanks, Barry. So the second pitfall that we'll be discussing is about EPO plans. EPO stands for Exclusive Provider Organization. With the rollout of Obamacare policies, people were seeing EPO plans for the first time in 2014. Nobody knew what an EPO was. An EPO plan uses a specific network of doctors and hospitals, but unlike a PPO, an EPO provides no out-of-network coverage, so it's more like an HMO. So if you go out of network, you're not going to get any coverage under an EPO plan. Many consumers are unfamiliar with the term, bought EPO plans or didn't know they were buying EPO plans, and ended up getting hit with huge out-of-network, out-of-pocket costs. On top of that, some companies who sell both a PPO and an EPO offer a smaller, an even smaller provider network for their EPO plans versus their PPO plans, another fact that consumers are unaware of. For example, according to one of Consumer Watchdog's lawsuits against HealthNet sold an EPO plan with 54% less doctors than HealthNet's PPO plans, but didn't tell people who were enrolling. So people didn't know that they didn't have any out-of-network coverage, and they didn't know that they had a narrow network. So consumers should be aware, if you're buying an EPO plan, know that you have no out-of-network coverage and only visit in-network doctors and hospitals in order to use your coverage. The third pitfall we'll be discussing today are multiple deductibles and skyrocketing costs. So consumers in all types of plans, PPOs, EPOs, HMOs, must meet an annual deductible before you get any coverage. And then once you meet your deductible, the insurance company will cover some portion of the cost. Now, insurers are using multiple and often hidden annual out-of-network deductibles that consumers don't know about. So on top of meeting your in-network deductible, you now have to meet a much, much higher out-of-network deductible before you get any out-of-network care. Most consumers don't know about this second, sometimes hidden out-of-network deductible. And once you meet your out-of-network deductible, usually the insurance company will only cover 50% of your out-of-network care, if you ever even meet the out-of-network deductible. On top of that, there are hidden limitations on what actually applies to meeting your deductibles. So insurance companies can hide terms that prevent any costs that you pay from going towards your deductible. So consumers don't know what goes towards their deductible. They don't know that they have multiple deductibles. And consumers should be aware when they're looking at policies, specifically PPO policies, look at all the out-of-network terms and make sure you understand what kind of out-of-network coverage you have. And one example is with Cigna PPO plans. They require consumers to meet a $12,500 out-of-network deductible before they'll give people any coverage at all. And when they're using a narrow network and people can't find doctors, and they're forced to go out of network, they're bearing much more costs than they thought they would when they bought their policy. And our next consumer, Lauren Katz, had one of these Cigna PPO policies with a huge out-of-network deductible, and she'll talk about her experience with Cigna right now.
Hi, I signed up for Cigna during open enrollment, and the reason why I signed up for Cigna was because I knew that I was planning on getting pregnant that year, and Cedars-Sinai, the hospital that I wanted to deliver in, took Cigna. When I became pregnant, I started shopping around for OBGYNs, and I got recommended quite a few. I called them all, and none of them took my Local Plus plan, and I realized that my network was much narrower than I thought it was. I called up Cigna and I asked them to email me a list of in-network doctors, which they did. There was one OBGYN that worked out of Cedars-Sinai, so I had to go to her. It turns out I liked her, thank God, and I started seeing her, and then a few months later, I started getting bills in the mail. And I'm like, okay, I already met my deductible. I had a $2,000 deductible, I met it. Why am I getting all these bills? And it turns out, I find out that they're no longer, this doctor is no longer in network. They didn't tell me, I had no idea. I didn't even think the doctor's office knew because they still told me that they were taking this insurance. And I just got slammed with bills. It was already far along in the pregnancy, so I couldn't even switch OBs, and I didn't want to because I wanted to deliver at Cedars. So sure enough, I had to pay all that out of pocket, and by the time I realized, I was already in my 7th month, and I wasn't going to switch in my 7th month of pregnancy. After my child was born, we found out that she was severely lip-tied. So we called up. This was a week after she was born, and she was having a hard time eating. So we called up Cigna to find in-network pediatric ENTs. There were 2 pediatric ENTs on the list. One was over an hour and a half drive away, and she was a newborn baby. She was a week old. I wasn't going to drive her an hour and a half. The other one was a number that was disconnected. This doctor worked in Children's Hospital. The doctor was out of town for 2 weeks. We ended up going to Children's Hospital, and we had the procedure done, and they hardly covered any of it. And this is my experience with Cigna. They've really, you know, it was supposed to be a really joyous and exciting time of my life, and they've managed to make it stressful and just a huge burden. And I'm very, very resentful. Thanks.
And our 4th pitfall is canceled plans and fewer options. Insurance companies are entering the individual market and canceling plans after 1 or 2 years, leaving people scrambling to find coverage and with few options. For example, people who want to buy a PPO on the Covered California Exchange in most of California are only limited to Blue Cross or Blue Shield. People who enroll in new United Healthcare plans should know that they're selling new plans for 2016, but United Healthcare's CEO recently announced that it looks like they're going to exit the individual market in 2017. So people with United Healthcare policies may lose their coverage at the end of 2017. Also, HealthNet stopped selling its Covered California PPOs in 2015 and now is canceling its off-exchange PPOs as well, leaving consumers having to look for coverage. And for consumers whose policy has been canceled, just remember that you have to sign up by December 17th if you want coverage by January 1st, or the open enrollment period ends January 31st, 2016. Remember to look at all the policy terms before you get a new plan and make the deadline. And our next consumer, Jerry Huffman, was enrolled in a HealthNet PPO who his plan was recently canceled, and he'll talk about that now.
Good morning. Yes. So I've actually been in the insurance individual market for 30 years, and I have a litany of horror stories of of 30 years worth of shell games with various insurance companies. And we're here today to talk about the latest, which is my Health Net policy. So in the first year of Obamacare, I guess that's 2014, I signed up with Health Net and then renewed my policy in 2015. And I was, earlier this year, I've been very fortunate to work with a very educated agent for many years who's kind of helped me through various situations and pitfalls with my insurance company. And I called him at the end of September and said, you know, my renewal is going to be coming up in December, January, and what are we going to do? How are we going to, we're going with Health Net again. And he actually said to me on the telephone, Health Net is pulling out of the insurance market in Los Angeles, Beverly Hills, Santa Monica. Those are the cities I remember now. But primarily, I was affected because I'm a resident of Los Angeles. And I said, oh, they're pulling out of the market. And he said, well, just in those cities. I mean, if you live in Glendale or Burbank, you can still have your policy. It's only for, you know, the cities that I've listed. And I was astonished. I thought, surely this can't be right. So I picked up the phone and I called the Department of Insurance in Sacramento and got a nice person there who listened to my problem and promptly sent me a letter saying, you know, you can file a complaint if you wish to, but this is perfectly legal. There's nothing that we can do about this. They can pull out of any area that they choose to. And it's just amazing to me that they could operate in the state of California, but say we're not going to operate in the largest, most populous city in the state. And they essentially, you know, with those pulled out of 10% of the market, we're just not going to offer it to you. And so I was kind of on the warpath about this, and I contacted Jimmy Gomez, who is my state assemblyman. I went to Kevin De Leon's office. I went to Adam Schiff's office. I called the mayor of Los Angeles's office. And this was not on anybody's radar. And it didn't seem like anybody really cared, you know? And it's just, it's very, very discouraging that that as a consumer, you really feel like you're in this kind of macabre dance anytime you deal with an insurance company. You know, so I've been looking for plans, and you know, one of the things that I did was I called Kaiser. I thought maybe I'll go to Kaiser this year, and I get someone on the phone, and they say we're going to put you through with our licensed representative, who's you know, licensed to deal with insurance plans in California. And they put me through, and the first question that the person who is supposedly the expert at Kaiser about insurance plans in California, when I said I lived in Los Angeles, was they asked me, do you live in Southern California or Northern California? Where is Los Angeles? Which part of the state? And that, you know, is just an example of like the kind of thing that can happen when you call an insurance company. You know, I was astonished and not very confident that I was going to get any clear answers about what they might offer. And so I have found a plan, but having been in the healthcare market for as long as I have been, you know, I'm really waiting for January 1st to find out if what I've been told is true. You know, last year I tried to switch plans, and I was going to go with Assurant and spent much time on the phone with them about what I needed. And I signed up with them, and January 1st, I walked into my pharmacist's office and my medication wasn't covered. And I called Assurant and I said, you know, what's the deal with this? On December 20th, you told me the medication was covered, and on January 5th, it's not. And they said, well, you know, we didn't have the formulary. We reserve the right to change the formulary. So I'm here today just to participate in this press conference because of the 5 lumps of coal and the many experiences I've had, and just to really encourage people to be, you know, very thoughtful and careful about what you're signing up for, because the insurance company, it's definitely not our friend. You know, it is not your friend. And that has been my experience. Thank you.
So our 5th and largest lump of coal here today. Insurance companies are enjoying huge profits while, as you've heard, shifting the cost to consumers. California insurance companies have made huge profits by reducing people's access to care. As premiums and cost sharing increase for consumers, health insurance company profits are also rising. Blue Shield reported a profit of $107 million in 2014, and Kaiser made $66 million on Obamacare policies in 2014. By reducing networks and limiting people's access to doctors and hospitals, insurance companies are reducing the number of claims that come in. By shifting the cost of out-of-network coverage and increasing deductibles and imposing limitations, insurance companies are paying out less and they're raking in more. The best way to prevent insurance companies from unfairly taking your money is to keep good notes, keep good records, take screenshots of provider lists, look at all the policy terms, and just keep records in case your claim is unfairly denied. And if you still have problems, we encourage consumers to come to ConsumerWatchdog.org and report your complaints. Thank you.